Have you ever wondered, what if it's not just aging? What if the brain fog, the forgetfulness, the memory problems aren't simply because you're getting older? As a home care nurse, prior to going into my patients' homes, I would read over their charts. I would see that they may have a diagnosis of Alzheimer's or dementia. And then I would always see the trifecta of medications, is what I call it: the PPIs, the sleep medication, and the anxiety medications. And I will think to myself, would this patient's memory be better if we could help them to understand the root cause and possibly eliminate these medications? Because are we only treating the symptoms, or are we also asking, why are these symptoms developed in the first place? Today, I want to talk to you about 7 common medications that taught me to ask better questions. If you're tired of sugar cravings, brain fog, fatigue, and all the conflicting health and diet advice, and you just want to know what's happening inside of your body, you're in the right place. I'm Tashawn Davis, holistic health coach, registered nurse, and metabolic health educator. I help you break sugar cravings through balanced blood sugar so you can take your health back naturally. So grab your favorite sugar-free drink, pop in those earbuds, and let's learn how to work with our body and not against it. Before we jump in, I have 2 quick invitations for you. First, I'd love for you to join me on the remaining stops on our free summer metabolic health experience tour. If you've been enjoying this podcast and want to learn more about insulin resistance, blood sugar, metabolism, and practical ways to improve your health, I'd love to meet you in person. We will be all over the Central Florida area. And you can find all of these dates and locations at www.healthbeyondweightloss.com. And secondly, I'm so excited because we're opening enrollment for the first 6-week metabolic intensive. Through this Friday only, though, we're offering a founding members price, which includes $100 off the program. This program will never be this low again. If you've been wanting personalized education and coaching to truly understand your body instead of simply chasing the symptoms, now is the time. Again, visit www.healthbeyondweightloss.com. And these will only be in person because I feel like we're missing that in-person meetup and communication. So we're taking 25 participants for 6 weeks starting August 22nd. Make sure you join. We had our first stop on our tour today, and many people already signed up. So if you've been thinking about it, I would sign up before Friday, and then you'll also get your $100 off. I would love to see you all in your smiling faces. Now let's jump into today's episode. One thing I loved about home health nursing was I wasn't rushing from room to room like I had to do in the hospital. I really had the opportunity to get to know people. Before every visit, sitting in my car, saying a quick prayer, then reviewing their chart. Many times I'd see congestive heart failure, COPD, type 2 diabetes, and so on. Then I flip to the medication list, and sometimes 10, 15, 20 medications, and my heart would hurt for them. Not because anyone had done anything wrong. Those families loved their mom, their dad, their spouse. They were giving every medication exactly the way the doctor prescribed, trying their absolute best. But I couldn't help but noticing something. Many times I see medication for heartburn, cholesterol, sleep, anxiety, pain, and I think, I wish someone had also explained how beautifully connected the body really is. Because that's one of the greatest gifts God has given me as a nurse. Not simply caring for people, but helping them to understand their bodies, helping them to ask better questions, because understanding gives people hope. So today, let's talk about the 7 medications or medication categories that made me stop and ask, why? So I'm not telling anyone to stop taking their medications. Many medications people may need. So always ask your healthcare provider first. And today isn't about fear, it's about understanding. Because every medication tells a story. We don't want to put a band-aid on a bullet hole. We want to get to the root of it so that we can talk to our doctors about eliminating it with understanding. Remember, that's why this podcast exists. I want to understand what I'm doing so that I can talk to my doctor with these understandings. So number 1, is Benadryl, or also known as diphenhydramine. Everybody has this medication in their cabinet. And many people tell me I can't sleep unless I take Benadryl. Most people know that it makes them sleepy, but they don't know why. Benadryl blocks one of your brain's important chemical messengers called acetylcholine. Think of acetylcholine like one of your brain's communication systems. It helps with learning, memory, attention, and concentration. When you block those signals, you become sleepy. That's one reason the American Geriatric Society recommends avoiding them long term, especially for every night, 2 Benadryls to go to sleep. This is what I was seeing my patients' medications. And it increases the risk of confusion and cognitive problems. Let's ask different questions. Why can't you sleep? Is your blood sugar dropping overnight? Are you eating too late? Do you have too much caffeine, sleep apnea, stress? Or could insulin resistance be really a part of the story? If you're dealing with belly fat, prediabetes, type 2 diabetes, or high triglycerides, it's worth having the conversation with your doctor, because improving your medication may improve your sleep. Number 2, acid reflux medications like Prilosec, Nexium, Protonix, Omeprazole, Pantoprazole. People think these medications simply reduce stomach acid, but stomach acid actually has an important job. It helps digest protein, release vitamin B12 from your food, and it helps with absorption with things like magnesium and iron, and protect us from harmful bacteria. Long-term use of these medications have been associated with vitamin B12 deficiency in some people. Low vitamin B12 itself can contribute to fatigue, neuropathy, balance problem, and memory changes. Researchers have also looked at whether long-term proton pump inhibitor use may be associated with cognitive decline. We can't say that these medication causes dementia, but we can say it's another reason to review long-term medications with your provider. These medications should only be taken for 2 weeks at a time. And if you've seen my other episode, if you haven't seen it, check my other episode about acid reflux, because I go deeper into this subject and why you need to increase your stomach acid. So ask these questions. Why do you have reflux? Is it eating too late? You're eating larger meals? You have extra abdominal weight, a hiatal hernia? Or, again, could it be insulin resistance? A conversation worth having. Number 3, cholesterol medications or statins. This surprises people. We've been taught cholesterol is bad. Actually, cholesterol is essential. Every cell in your body contains cholesterol. Your body uses it to make hormones, vitamin D, bile acid, and here's something many people don't know. Your brain contains about 20 to 25% of your body's total cholesterol. Your brain actually makes most of its own cholesterol because cholesterol from your bloodstream doesn't easily cross into the brain. So if you've been taking this medication and you have brain fog or memory changes, don't ignore it. Have a conversation with your healthcare provider and ask another question. Why did my cholesterol become elevated in the first place? Or is this even an issue? Because if you're eating properly, low carb, low sugar, higher cholesterol, there's studies that show that a higher LDL with the right NMR, which is a ratio, is more heart healthy. And we'll dive deeper into that. Some of my other episodes may have some of this information as well. Is it inflammation? Is it metabolic dysfunction? What's happening? Number 4, anxiety medications. Xanax, Ativan, Valium, Klonopin. We know that mental health is real. Anxiety is real. These medications can be helpful, but long-term use may affect attention, reaction time, and memory. Don't stop your medications without asking, but ask, why is the anxiety here? Could blood sugar swings be contributing? Poor sleep, chronic stress, hormonal changes, inflammations? What is it? We need to continue to ask these questions. Number 5, prescription sleep medications like Ambien, Lunesta, and others. These medications may be helpful for short periods of insomnia, but here's something I want you to think about. Being sedated isn't always the same thing as getting restorative sleep. God designed our bodies to cycle through different stages of sleep, including deep sleep and REM sleep. Those stages are important for memory, learning, healing, and overall brain function. So if someone tells me I've been taking a sleeping pill every night for years, so if someone tells me I've been taking a sleeping pill every night for years, my next question isn't which one. It's why isn't your body sleeping naturally? Could it be stress? Could it be untreated sleep apnea? Could blood sugar be dropping in the middle of the night? Are you eating too close to bedtime? Are you scrolling your phone till midnight? Guilty sometimes. Or could insulin resistance be contributing? These are some questions worth asking. Number 6, opiate medications. Pain medications like hydrocodone, oxycodone, morphine. We know that pain is real and no one should have to suffer. But pain medication can also be causing slow thinking, drowsiness, decreased alertness, and it can be sometimes contributing to brain fog. So ask, why is the pain there? Is it arthritis, neuropathy, inflammation, and injury? Extra weight, putting pressure on the joints? Could improving metabolic health reduce inflammation and help lessen some of the burden over time? Have you noticed the pattern yet? I'm not asking, should you stop your medication? I'm asking, what's the rest of the story? Number 7, polypharmacy. Number 7 may actually be the most important. It's called polypharmacy. That's simply a medical term for taking multiple medications at the same time. Sometimes it's not one medication, it's 10, 12, 15. Every medication may be appropriate. Every medication may have a purpose, but together they can increase the risk of medication interactions like dizziness, falls, confusion, fatigue, and cognitive changes. This is one reason I encourage families, especially those caring for aging parents, to periodically ask their physician or pharmacist to review every medication together. Sometimes medication that makes sense for 5 years ago may no longer be needed. Some dosages can be adjusted. Sometimes another medication may be a better option. Those conversations are worth having. Here's the bigger picture. This episode isn't about medications. It's about understanding. As a nurse, one of the greatest privileges God gave me wasn't simply taking care of wounds or checking blood pressure. It was educating. Because watching families feeling overwhelmed to finally understanding what was happening inside their loved one's body was such a big joy for me. Knowledge brings hope. Knowledge gives people options. Knowledge helps people ask better questions. And that's exactly why I love teaching physiology. Because once you understand how beautifully connected the body is, things begin to make sense. Now, let me bring it back to something you've heard me talk about over and over again: insulin resistance. Am I saying insulin resistance causes every one of these problems? Absolutely not. But if you're experiencing signs of insulin resistance, things like belly fat, prediabetes, type 2 diabetes, high triglycerides, fatty liver, skin tags, high blood pressure, or brain fog, I think it's worth asking your healthcare provider whether or not insulin resistance could be a part of the picture. Because if it is, improving your metabolic health may improve much more than your blood sugar. That's why I get excited when a client tells me, Tashawn, I came to lose weight, but I can think again. My brain fog is lifted. I have more energy. I finally feel like myself. Those are some of my favorite coaching moments because that's what it is really about, helping people get their lives back. In Hosea 4:6, it says, my people are destroyed for lack of knowledge. I don't believe this verse tells us to reject medications. I believe it reminds us to pursue wisdom, to learn, ask questions, and to become better stewards over the body that God created. And every time I study physiology, I stand in awe of His design. All right, before we go, I love to invite you to take the next step. If you've been listening to this podcast and thinking, I wish I understood my body better, join us for the free Summer Metabolic Experience Tour. We'll be talking about all of these things, the type 2 diabetes, blood sugar, metabolic health, nutrition, and practical steps you can begin applying immediately. Our next featured event will be held next Sunday from 4 to 5 at the Alafaya Branch Library. If you're ready to stop guessing and tired of chasing symptoms, and if you're ready to understand the physiology behind what's happening in your body, I'd love for you to become one of the founding members. Through this Friday only, $100 off of our inaugural 6-week metabolic intensive. This is our founding members pricing, and this price will never be this low again. We'll spend 6 weeks diving into insulin resistance, blood sugar, meal planning, hormones, lab interpretation, food labels, cravings, fasting, sleep, movement, and how all of these systems work together. If you're serious about transforming your health through education and understanding, this program was for you. www.healthbeyondweightloss.com to learn more and register for free, and the link will be in the show notes. And before you leave, if I can ask a small favor, if this podcast has encouraged you and if you've learned something, please write a review and share it with your friends. And thank you for celebrating. This is our 30th episode. May God bless you and keep you. And remember, you are needed in this hour. Alrighty, my friend, if this episode has helped you understand your body a little bit better and helped you have the confidence to make better informed healthcare decisions, share it with someone you know who may be struggling with sugar cravings, brain fog, or fatigue, because they may not even realize that blood sugar could be the reason. And also leave a review because it really helps more people find this. Remember, the goal is to reverse 1 million type 2 diabetes in my lifetime. And as always, I want to remind you the harvest is plentiful, but the laborers are few. And some people are fighting every day just to have the health and energy to live their everyday life that they were called to live. So I am praying for your health. I am praying for your strength. And I'll see you on the next episode.